Hi, my name is Maya Lawrenson. I'm a nursing student at the University of South Alabama, and I'll be administering heparin today. Here's my nursing ID. The first thing I'm going to do is say that this is a no interruption zone, so no communicating, no talking on the phone or texting or anything like that. So the next thing I'm going to do is my first check for accuracy. I'm going to verify the 5 rights between the order form and the MAR. So Jaguar J. Jones, heparin, 5,000 units, subcutaneously, every 12 hours, The next thing I'm going to do is verify the allergies between the order form and the MAR. So allergies penicillin. I'm going to perform hand hygiene, and I'm going to go to the medication room and select my medication, which is heparin. So, heparin 10,000 units per milliliter, so I am going to be administering 5,000 units, which by calculations it is half a milliliter, or 0.5 milliliters. I'm going to check the expiration date. It is December 5th, 2025, so we're good on that, and it was last administered 12 hours ago. Because it is a subcutaneous injection, I'm going to be using a 1 milliliter tuberculin safety syringe. So I'm now going to clean my vial, or the top of my vial. I'm going to take my syringe out and take the cap off. I'm going to pull out half a milliliter of air, which is equal to the amount I will be administering. I'm going to do this. I'm going to release the air, and I'm going to get half a milliliter of heparin. Alrighty. After I've gotten that, I'm going to recap the syringe with using the scooping method, and I'm going to verify again. So heparin 10,000 units per milliliter, and I'm administering 5,000 units, which is half a milliliter or 0.5 milliliters, which I have in my syringe. So. Alrighty, I am then going to go verify my medication with another nurse as indicated, as well as verify the calculations. I am then going to check my 5 rights again. So for the second time, so Jaguar J. Jones, heparin, 5,000 units, subcutaneously, every 12 hours. And I'm going to make a label for my syringe, which is going to have the patient's name, the dosage, the medication, and I'm going to initial it. Alrighty, and I'm going to place this around my syringe. And I'm going to take my syringe in the MAR form to the patient's room. I'm going to perform hand hygiene. I'm going to identify the patient using 2 identifiers on the armband and the MAR. So Jaguar J. Jones, date of birth 8/25/1963, 8/25/1963, MR number 417-6352. I'm going to identify the allergies, which is penicillin. Mr. Jones, I see that you're allergic to penicillin. Luckily today we're not going to administering that, so you should be good on that. And I will also perform pre-administration assessment for heparin. The next thing I'm going to do is check my 5 rights again. So Jaguar J. Jones, heparin, 5,000 units subcutaneously every 12 hours. I'm going to explain the order to my patient. So Mr. Jones, I'm going to be administering heparin in your abdomen area. This is a subcutaneous injection. I'm then going to raise the bed to a working height and lower the side rail, and I'm going to apply my gloves and goggles. then going to explain where I'm doing this on the abdomen. So you will locate this 2 inches around the umbilicus, not going above the costal margins, not going below the pubic area, and not going past the anterior superior iliac spine. So first I'm going to clean my injection site with an alcohol swab in a circular motion. Okay. I'm going to take my syringe, take the cap off and put that in the shelf container. I'm going to pinch up 2 inches of skin and inject at a 90-degree angle. I'm going to do this. I'm going to inject it slowly. I'm going to take the syringe out and apply pressure. I'm going to apply my safety cap and put that in the shelf container. I'm then going to position my patient comfortably, lower the bed and raise the side rails, and I'm going to take my gloves and goggles off, so glove to glove, skin to skin. And I'm going to perform hand hygiene. And then I'm going to assess the patient for any allergic reactions, and then I'm going to go document on my MAR as well as document the patient's response to the medication. And then I'm going to assess the patient as needed.